Good evening, all, and welcome to another special episode of Respire. I am Sandeep Akula, representing from NATCO. So, Respire Lung Cancer Awareness, one voice at a time. It's a joint initiative by Voice of Healthcare as well as NATCO. And here when we talk about Respire, raising awareness to fight against lung cancer. So, lung cancer remains one of the leading cancer-related deaths in India, and also there are a lot of misconceptions, myths, and gaps in understanding lung cancer. So henceforth, it falls into the shadows of focus and a need and expertise opinion. So today we have with us a renowned medical oncologist, Dr. Goutam Santosh Panda from Bagchi Shankara Cancer Center and Research Institute, who makes us understand the vital aspects involved in lung cancer and also throw some light on lung cancer awareness. Welcome, sir. Good evening. It's pleasure.
Good evening. Thank
It's
you.
pleasure to have you on our Respire platform, sir. So when we talk about this lung cancer awareness, the first point comes into the mind is that understanding the burden. So what are the trends you see generally in incidence of lung cancer in India?
So the most common trend which is seen in India currently is the incidence of lung cancer in non-smokers and in females. The incidence is increasing, and the incidence is increasing not only in the urban areas, also in the rural areas. This is the trend which is slightly changing from the last few years, in which the cancer was more common in the smokers and in the urban areas.
Okay, sir, when you talk about this smokers and non-smokers, so how often non-smokers are affected?
So basically, the smokers and then coming to the non-smokers, both can have lung cancer. It is not that only smokers have the lung cancer, but the thing is, smokers have a higher risk of lung cancer, specifically those who are current smokers or have quit the smoking just recently. For smokers who have quit the smoking few years back, say 15 to 20 years back, the risk is almost same as the non-smokers.
Okay. So when we talk about the risk factors, sir, anyways, you are saying tobacco usage is more. Apart from tobacco usage, any other risk factors, sir, for this?
So, as I already said, main is the basically smoking. But apart from smoking, there are other risk factors like some environmental risk factors. Then second-hand smoking and third-hand smoking for those who are non-smokers actually, but they acquire the smoking as second-hand or third-hand. Apart from that, there are some genetic factors also which play into develop.
Is there any air pollution also and
Hello, am I audible?
occupational exposure also to some extent, sir, for lung cancer awareness? No.
You were
Sir,
not
can you hear
clear
me?
actually. Can you please repeat? Yes, 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 yes.
Air
Audible now.
pollution also affects.
Yes, yes, definitely. The environmental risk factors include the air pollution, some particulates like the radon, and some other factors also they come into play.
Sir, it is very crucial to for having an early detection in lung cancer when we talk about diagnosis and screening.
Yes. So definitely in India, most of the lung cancers they present as locally advanced stage. So as the stage increases, or we say the burden increases, the outcome becomes poorer. So the early we pick up the tumor, the better is the outcome. So it is definitely a good thing to pick up the tumor early and treat it as early as possible.
Okay. Coming to the current guidelines, sir, for lung cancer in high risk stages, what are the current guidelines for screening?
For screening. So there are various guidelines actually, but the one thing which is commonly followed basically, screening is for basically high risk population. High risk includes patients who are more than 50 years of age and are current smokers or have quit smoking in, for less than 15 years and have smoked at least 20 pack years in their lifetime. They should be screened with low dose CT annually, and the upper age limit is not determined. It is uncertain, but definitely we should start screening from the age of 50 years if he is a smoker, and it should be annually every year.
Any methods, sir, like CT or low dose CT?
So low dose CT is the current recommendation for the screening purpose. So it is a traditional CT with low exposure of the radiation, which is called low dose CT. So the radiation exposure is not as much as we see in the as much as we see in a conventional CT scan of the thorax. So it
Sir,
is
how far
the
this?
yes, yes.
Yeah, please.
So
Please, sir,
there
please.
is less risk of radiation hazard because the radiation in a low dose CT is very low.
Sir, this low dose CT is accessible and affordable to, because in Eastern Belt you find many rural areas, so they able to accessible to this low dose CT, sir.
So so it is accessible, but thing is, if we implement it, we have to be very careful in implementing because we have to do it very rigorously. And second thing is the reporting has to be very carefully reported, and there has to be a dedicated radiologist who is expert in reporting the low dose CT, like we see in various other diseases like breast MRI and multiparametric MRI of the prostate. There has to be a dedicated radiologist who knows in and out of the scan. He can only report, not a regular radiologist can't report it. So there are a lot of things involved in this thing, but yes, it is possible and it is doable also.
Okay. So you talked about signs and symptoms. Then coming to this,
Because yes,
yeah, please, please.
because if a normal radiologist reports it, there might be a various high false or positive rates, which might lead to another investigation and invasive procedures, which might not be cost effective. So radiologist plays a very important role here. Basically.
Okay, sir, you talked about screening methods. Coming to signs symptoms, what symptoms should patients never ignore, sir, in this lung cancer? Which are the major symptoms?
So the main signs and symptoms include basically the cough, dyspnea, that is shortness of breath, cough with a tinge of blood, arm pain, chest pain, and it can present with various symptoms related to the organs. Like if it has spread to the brain, it can present with headache, vomiting, nausea, blurriness. If it has spread to the bones, it will present with low backache, which is not relieved by multiple painkillers like this.
Okay, okay, sir.
Loss of
And
appetite. weight loss, fever. This will be the symptoms.
And coming to the treatment part, sir, how is the treatment landscape in lung cancer, sir? How it has been evolved from last decade, if you take, or last
So,
20 years? Hmm.
previously, most of the lung cancers were basically advanced, and they were mostly treated by some form of chemotherapy. The outcome used to be very poor, say 7 to 8 months of survival on an average. But with time, the treatment also has changed. We now have surgery for the early stages. For locally advanced ones, we can use multimodality therapy, that is the use of surgery, radiation, chemotherapy, targeted therapy, or immunotherapy. For diseases that are spread outside the lung, we can again use multiple modality like targeted therapy, immunotherapy, chemotherapy, or combination of one of these, plus or minus surgery or radiation as per the requirement.
Sir, how different targeted therapy is from chemotherapy, a regular chemotherapy? How it is different, sir?
So,
Targeted.
yes, good question. Chemotherapy basically kills the normal cells as well as the tumor cells. So, chemotherapy affects the tumor cells and the normal cells. So the normal cells also die. So, we have a gap between the two chemotherapy cycles for the normal cells to recover. Say 1 week or 2 week or 3 weeks, depending on the dose. But unlikely the targeted therapy, they target the tumor cells, so the side effects are very less compared to the chemotherapy. And since it targets the tumor cells, the effectiveness is also higher. So when we look at the chemotherapy and targeted therapy, effectiveness is higher, side effects are lower in the targeted therapy group.
And how this
So
immunotherapy is
yes,
different from other exceptional therapies, sir?
so we use basically what we use in immunotherapy is agents which activate our immune system to fight against the cancer. So it takes some time. Basically, it is not rapidly acting. So
Hmm.
whenever a patient is symptomatic for lung cancer, it is better to combine the immunotherapy with chemotherapy or chemotherapy alone. Giving immunotherapy alone in a very symptomatic patient will not lead to any relief of the symptoms. Though it might be effective in the long run, the symptoms will take some time to get resolved with immunotherapy.
Okay. Okay. So, anyways, you are talking about treatment, sir. There is same linking question is that how it is affordable to the patient. Immunotherapy, be it targeted therapy.
Yes. So let me be very clear. So affordability is one question, and one thing is survival. So when we see a lung cancer patient, he or she might be some 20 years, 30 years. Recently, I was seen patient who was basically 28 years old, and she was all positive. So she has whole life ahead of her. So cost is one thing. It is not. It is quite cheap. It is slightly costlier compared to the chemotherapy, but it is way better effective than the chemotherapy when I talk of the targeted therapy or immunotherapy. For those patients who are on immunotherapy, the 5 year survival rate was 32% with immunotherapy. which was 6 to 7 months of uh, survival with the use of chemotherapy. And when I talk of all ALK positive, the median PFS, that is the progression-free survival, was 62 months with the use of lorlatinib, that is a tablet. The OS is yet to be reported. So median PFS, that is 50 patient surviving more than 5 years with the control of a lung cancer is very remarkable thing. So yes, it is costly. It is not. It is very cheap, but it also leads to improvement in the quality of life and improvement in the survival. That is way significant than the chemotherapy. When we compare the cost and the benefit, so definitely the benefit is way much higher than the cost. Definitely, it is not cheaper. Gefitinib, one tablet a day for a month will cost you approximately 1,000 rupees, which is for the EGFR. If we talk for the lorlatinib, it will approximately cost you 1.5 lakhs per month, and on the other hand, chemotherapy will cost you approximately 10,000 per 3 weeks. So yes, targeted therapy and immunotherapy are costlier, but at the same time they are very good at improving the survival.
And before treating a patient, what kind of psychological impact or mental stress will be there with the patient?
Definitely, it differs with the patient. Patients who are young or in the middle age are different from those patients who are elderly patients. For those patients who are middle age, they are the whole bread earner of the family. So their main focus is basically if they get admitted or if they are not able to earn money, then the family will be striving. That is the main thing for them. Second thing is the thing is they think they have a deadline, say 2 years, 3 years. So they think that life is going to end. Patients who are elderly patients anyway, they are very down when they are diagnosed with the cancer, but they cope up. When I think they cope up better than the middle-aged patients, basically, because they don't have the burden of the family on their shoulder.
Okay, sir. And you talked about the treatments, immunotherapy, targeted therapy. In late stage cancer, also it is curable. Survival rate is you are getting good survival rate for the patient. But
Yes, yes.
why there is a stigma around lung cancer, sir? Even though so many therapies have evolved from last decade, why there is still a social stigma in lung cancer? Still,
So the thing is, most of the patients are not aware of the right treatment. They get treated by some quacks or some nearby doctors who are not aware of the proper treatment. They think that and they think that lung cancer will spread when they go near to a patient who is having a lung cancer. And the thing is, some patients think that treatment will be hugely costly, which is they are not affording. So there are a mix of things basically. Social stigma due to the unaffordability, social stigma due to the fear of spread, social stigma due to many things that they will not be able to handle the things.
so when we talk about insurance makers, policy makers, a lot of private insurance is there, and government insurance and central government insurance are also there, state as well as central. But as per you, what kind of steps should policymakers take to reduce this lung cancer burden, sir?
So I think lung cancer screening should start in India first thing, and they should start screening for the high risk population for the screening part. For the treatment part, I think they should at least approve the low dose immunotherapy part, which is feasible actually, and it is not costlier also. And with the availability of the generic immunotherapy in the coming few months, it is it will be quite cheaper actually, immunotherapy. So I think at least these two steps government can take, like low dose CT screening and the uh, making the low dose immunotherapy or full dose immunotherapy available in making it available in the some schemes like.
One, uh, as per your clinical experience, what is that strong hope gives you to treat a lung cancer patient, sir? As per your experience.
Actually, my hopes are basically my patients only. I've seen patients who have huge lung mass. Almost all of the lung was occupied by the lung mass. They are doing well till now for last 4 years on immunotherapy, and some are getting the targeted therapy for last 4 years, and they are doing it. So seeing the patients who are doing well on their, and some are studying, some are working also. They are not just idly sitting at home. They are doing their routine work and they are getting treated. So they are the biggest of this.
So, one powerful message to our viewers, sir, on lung cancer.
So never lose hope. Light is always there at the end of the road. So we should never lose the hope of being cured.
Okay, sir. Thank you, sir. Thank you explaining each and every vital aspect involved in lung cancer, as well as you have shown some light how in treating, as well as what are the signs and symptoms, and what could be the risk factors to our viewers, sir. Thank you very much, sir.
Thank you.
Thank you, sir. Thank you. And also, I'll thank you, the back
Thank
end support, and also Voice of Healthcare once again. Thank you very much.
Yes, yes. Thanks to them also.
Yes, sir. Thank you. So we can leave the studio, sir. No issues.